Welcome, everybody. I'm really excited to have you watching my program today. Today, I've got the honor of having another one of my mentors on my program here. This is Dr. John Scaringe. Again, we've got a little bit of some craziness with Zoom, so I'm going to be recording this on Zoom, but the Facebook live stream is going to be with my computer going this way right here, so you'll be able to see and hear Dr. Scaringe and also see myself there. Can you see that okay, John?
I'm trying to get on the live stream at this time, so.
It's fine. It'll come through in just a second there. And then we'll also be uploading a recorded version of this later, but we wanted to make sure we could answer your questions. So just for a little history for you guys, back in 1999, when I was a student at LACC and in the clinic, I had the misfortune with a couple of my classmates, Vinny and Ryan, to have one of the roughest supervising doctors, and we really weren't learning very much during that time, and it was a little depressing. Fortunately, the school kind of parted ways with him, and then we were blessed with going from last place. We basically went from being with the Cleveland Browns to being with the New England Patriots, and we got Dr. Scaringe as our supervising doctor. Everybody else in our class was jealous. They're like, oh my God, how'd you get Dr. Scaringe? You're so lucky, you're gonna learn so much. And I did. In that short time that I had you as my supervising doctor, it was absolutely amazing. You've been highly instrumental in me being successful. And I know Vinny and Ryan will, share their opinions too about how great you were for us. So I'm excited to have you on the show. Before we get to asking you the questions, I just want to give the listeners a little bio on you. So Dr. Scaringe has been the president of Southern California University of Health Sciences since May of 2010. So happy anniversary for your 10 years.
That's right.
There. He's also served as the chair of the Chiropractic Procedures Department for the Department of Diagnosis for LACC, that's Los Angeles College of Chiropractic, before directing the University Health Center in Whittier, which is the largest outpatient care center at Southern California University of Health Sciences. And in 2001, he became Dean of Clinical Education, and in 2005 was Dean of the Los Angeles College of Chiropractic and Vice President for Academic Affairs in 2007. Now, in addition to those accolades, he's also a published author and has served as the associate editor for the Journal of Sports Chiropractic and Rehabilitation and on the editorial advisory board of Manual Therapy. In addition to private practice and over 25 years of teaching experience, Dr. Scaringe has developed a reputation in change management. So a big reason why I did you on the program today, and is a frequent lecturer on academic leadership and trends in healthcare and education. He holds a Doctor of Chiropractic degree from New York Chiropractic College, a Master's of Science in Kinesiology from Cal State Fullerton, and an EDD in Educational Leadership from Cal State University Long Beach. That's my wife's alma mater as well. So thank you for being on the show today, John.
It's my pleasure, and thank you for inviting me. It's just a thrill that I'm here with you, and just so proud of all your accomplishments. So thank you for having me.
Well, thank you. Like I said, I mean that from the bottom of my heart, that without your help and direction during the clinic, I know that it wouldn't be where I am today. So it's great to have you on here. Now, with that in mind, if you can kind of share for the listeners, what was your journey? What got you into chiropractic, and then going from chiropractic into private practice and eventually into, teaching other doctors and then running the whole university?
Yeah, it's, my brothers and I were student athletes, right? We participated in a lot of sports, from, being a child to organized sports, non-organized sports, all the way through college. In fact, three of us were collegiate athletes out of the four boys. And whenever we got injured, we went to our chiropractor.
Right.
That's what we did. So I went to college to teach and coach. I was a health, physical education, and athletic coach. That's what I graduated with in kinesiology. And while I was teaching, I decided I wanted to work with athletes. So I looked at different professions, and physical therapy was one of them.
Yeah.
And obviously chiropractic was the other. So went into chiropractic, developed a reputation really in sports medicine. Early on, I would volunteer every weekend at some type of an athletic event. And we had multidisciplinary teams. We had medical doctors, nurses, EMTs, athletic trainers, massage therapists, etc. And we were all there for one reason, for the athlete.
Right.
And as a chiropractor, I developed all these relationships, and we weren't competing for the almighty dollar, right? We were there for the athletes. So that became my integrative network.
Yeah.
You know,
I think athletes are a great group to work with too, because it's so much word of mouth travels, and they're so results oriented, and then they want to get out there and succeed. So I found, like, compared to when I was doing a lot of workers' comp, athletes will do what you tell them, especially if they see you as the authority, because they want to get out there and they want to perform better.
yeah, and they are into health. I mean, they want to increase performance.
Right.
So that's just health on steroids, right? Well, I guess I shouldn't say steroids,
Yeah.
but it really is. So that's where I had an appreciation for integrative teams. I mean, I didn't know any different. You worked together. That's what you did. And so I moved to California. I got a job at LACC, and was practicing part-time on the side, and just did a typical academic affairs route from faculty to department chair to dean to vice president, and then into the presidency. And I was practicing either full-time at the institution or part-time in private practice up until about 2002, 2001, when I went into administration full-time. So I've been a full-time administrator for, about 20 years now. And, when I made that transition, it was, I want to be the best administrator. And so I did, continue on with my advanced degrees in that, and got experiences, got involved in accreditation. And now I have a dream job. I'm combining my passions to treating and healthcare and education.
Yeah, it's really an amazing journey that you've gone through, and your journey, and also the school's journey. Like, when we're thinking of chiropractic schools, things are very different today versus, say, when I was there in the 90s and it was purely just a chiropractic college, or let's say versus even the 1950s. Like, what's changed for chiropractic education? And as you talk about an integrative model, like, what do you see as different? Because I know there's still some who don't want chiropractic to be integrated, who want it to be just one specific treatment, adjustments only, versus where you're really working with other specialties and getting the doctors to learn more things. How have things changed, and how does that impact the students today?
Yeah, I think that's an interesting and great question. I don't know. There's still quite a lot that's similar, and then there's some differences. I guess different. Did you have air conditioning when you were there? I mean,
no, not in the
we
clinic.
have air conditioning now, so
When I started
I'm only.
we were in that one building, no AC, and back then you guys required the males to wear a button-down
top
and the jacket.
And a jacket.
Yeah, and I sweat a lot anyway, and I remember to be like 105 degrees in Whittier in the summer, and you're already nervous because you're just a new intern anyway, and you're trying to work up this patient, and my hands are drenched, I'm getting the paper wet, and the ink is smearing, and I'm sweating like this, and the patient's like, should I let you treat me or not? So it was nice just when you guys let us wear the polos, but to have air conditioning, that would be a dream.
Yeah, so I'm seriously though, I think there's more digital support, learning support resources that are out there now. Some instructors take advantage and leverage that more than others. There's more professional student support when you're looking at focusing on student success and early detections of students that might be struggling, and then intervening. The other thing is, probably the biggest difference would be, as a DC student, you'd be sitting side by side with the doctor of acupuncture, Chinese medicine, and our physician's assistant program now. And they're there in classes together, learning from, with, and about each other. And that's our model, so that they can appreciate and respect what the other professions bring to a team. We have specialty concentration type of tracks, I guess, and we're improving that all the time. An example might be a sports medicine concentration, a functional medicine concentration. There's some clinical experience concentrations, and that's all included in your tuition.
That's great.
That much different than
Yeah.
when you went.
Yeah, that's different.
Yeah.
And you guys also have in your sports training program too. You guys have been working with a lot of Olympic athletes or whatnot coming through, and your facility looks great too. I mean, just the weight room that you guys have now, the rehab room compared to the dungeon that I was in back in the day.
Although that used to be the old cafeteria, and there's still
Yes.
no HVAC in there, so there's no air conditioning.
Right,
so
gotcha.
that'll bring you back to your college days.
Right.
But I think one of the biggest things too is our clinical internship experience. It's much more diverse, remote, not in university-owned clinics like when you went. They can go out into private practice. It's customized really for the student. It's not uncommon for students to be maybe 2 days a week with their supervising doctor, and then another 3 days out with a practicing chiropractor. So I think those might be some of the key differences.
Right. And now when we're looking at this integrated model, especially, considering the whole global crisis we've gone through and the way the world's going to emerge differently, how do you see this as being really beneficial to patients and to also doctors, especially with lower insurance reimbursements and maybe struggling and whatnot? How does the integrated model help? And if you can really, for those people, let's say, who may have some patients that are watching who don't really understand what an integrative model really means.
Yeah, I think when you look at the current system, it's designed for acute sick care, and it is more of a medical industrial complex, right? It's
right.
Not just a healthcare system. And when you look at 75 cents of every dollar going towards chronic conditions, and on a conservative estimate, right, 80% or more of those are preventable, and they're lifestyle related. So, it's not like, you have big interventions. It's just, here's your lifestyle: better exercise, nutrition, be involved, be aware more of your environment, those types of things. And chronic conditions are very complex. And require, I think, a tight team of providers. And instead of organizing around, the specialty and sole practitioner, I think a whole person or integrative, health model organizes around the patient. Or as Michael Porter from Harvard says, these integrated practice units that are around a particular patient population. And an example might be, that you see commonly is like sports medicine, right? That's a patient population. Oncology, and then maybe even subdivided a type of cancers. So it's these integrated teams that are around a specific patient population and conditions, and you become very gelled, and you're bringing different practitioners that are specific to that team. So the teams don't look the same, in different populations. And I think it's just more difficult to practice alone, even for economic reasons, right? With shared, services and things like that in an office. So an example might be, and if you don't mind me just going into a quick example here.
Go right ahead, please share away.
Yeah, a single family practitioner cannot provide the appropriate care like they used to. Okay, it's just too complex. And we have a relationship and research study going with Dartmouth in their community primary care clinic, and we approached that, and I think most practitioners in the complementary and integrated health area can say, okay, where can I show an impact? How can I come in and help? And we looked at, primary care, and primary care, they don't know a lot about, neuromusculoskeletal, say, and
Right.
back pain and spinal conditions. And when they see a back pain, patient come on their schedule, they know they're backed up. So we
Right.
can sit there and say, hey, we're going to relieve you. We're going to make life better for you. So that model is that the patient comes in, any neuromuscular goes right to the chiropractor.
Yeah.
Okay. Everything else goes to this integrated primary care provider who has an affinity and a passion for lifestyle medicine. Also the, functional medicine. He's really into that. So it's a great model, but it doesn't stop there, because the primary care would sit there, and because they don't have a deep knowledge, they refer to the specialist. Now the specialist, the spinal orthopedic and neurosurgeon, their schedule is now with non-surgical cases.
Right.
So we're as a chiropractic professional are screening those, and what we refer to the spine and neuro are actual surgical cases. So it saves money, it improves patient outcomes, and it's a team environment rather than that sole practitioner.
Yeah, that makes sense. And you especially when you think of the ease for the patient to move through a system. Well, even a place like Kaiser, you see huge delays in things where a patient will go in with say a low back condition, and then they get on this thing where, okay, take some ibuprofen and rest it and everything, and if it's still there in 4 to 6 weeks, then we'll set you to an appointment with physical therapy. And then they wait 4 or 6 weeks, and then they get a physical therapy appointment. And if that's not working, then they set them up for the ortho. And they're in this loop that just takes forever, and nothing is streamlined. And as you said, you got too many cases that don't need to be to the orthopedic doctor, and then ones who really need to be fast-tracked aren't there, and it gets a little wild.
Yeah, and then you get into those, chronic pain behaviors because you're delaying the actual, treatment that they need, more than 2 weeks out. So it definitely is a patient-centered model.
Right, absolutely. And it sounds like you guys are giving the doctors a lot more tools these days to work with when they get up, because I know when I graduated in 1999 and I finished and got out there, the first few years I was doing mostly adjustments only. And then I noticed about 3 years into it that patients seemed to be getting more complex, that as my skills were getting better, I was noticing that sometimes my results weren't as good. I'm thinking, okay, it's not that I'm getting worse. There's something that's going on where patients were getting more complex. And I started seeing where, the dietary changes, we're seeing autoimmune diseases were getting activated, that even if the, let's say as a chiropractor, if they're not treating that, you really need to be aware of this, so you understand that while you're working with somebody, there may be some underlying factors that are going on. Let's say if they've got like positive thyroid antibodies or rheumatoid arthritis antibodies, et cetera, that are brewing there, that's going to alter your treatment plan and possibly your expected outcomes. Is that something you've noticed as well, and something you're trying to help the patient and their students with these days?
Well, I don't see patients too much anymore. And I can tell you this, that if I was practicing now, 20 years later, I would be practicing totally different.
How would you be practicing it today?
I think I would have, I really like the concept of, that are involved with functional medicine. I just like the system-based approach there. That intrigues me. I think I would be, practicing, more in that. I think my passion was in sports medicine. I don't know if I'd still be doing that, maybe, more of an orthopedic, type of practice. I think there's, things like you're doing, like with laser and things like that. It just seems very fascinating that I think if I stayed in that arena, I'd still be using, those types of things. So, I agree with you. Things are changing, but as a entry level, preparing students for entry level chiropractic, we can't do it all.
No, you can't.
So if we can give them a good foundation, give them exposed to, different ways of practicing, that's where I think the specialties come in. Now, I think, I think we could, take just the functional medicine approach and boom, just concentrate everybody, on that. But
Yeah, not everybody wants that either. Not
yeah,
everybody.
so we decided to take more of, here's your good foundation, understand your basic sciences, which you can build on,
Right.
and have a path to, this specialty. And that's why we tried to look at some concentrations while you were in. While it doesn't make you that, proficient
No.
provider out there, it does expose you to more of that, and hopefully, get a taste to really get you excited about a track
Yeah.
in a direction.
It makes sense. And that's one of the things I loved about going to when it was LACC and now Southern California University of Health Sciences, the fact that you guys did expose us to other things and give us an education that, while we came out as good chiropractors, we also knew how to work with other professions. And instead of being this war, this us versus them, of trying to find where's the common ground, so that way the patient doesn't get blown up in no man's land between, battle between allopathic and alternative healthcare. It's like, how do we work together for the best interest of the patient? And I think that's one of the great things you guys are doing over there.
Well, we have a long way to go. Are
Yeah.
we better than we were? Yes. Am I satisfied where we're at? No. But I'm thrilled with the progress. What most practitioners out there just don't realize, they realize we're in a healthcare crisis, right?
Yeah.
But there's a higher ed crisis, and
Right.
I'm straddling both. So I have challenges in both worlds, and I'm trying to have a higher ed model that
Right.
can put us forward on a shoestring budget,
Yeah.
and yet the health crisis, trying to see how can we prepare our students to be successful now, but also to be successful in the future as
Yeah.
we start looking at more bundle payments and shared risk, not just fee for service, and then working in teams. So we're hoping that we can give them the competencies to work in any team environment when they leave, but yet they can still
Yeah.
function as a solo practitioner.
And let's say for the people who are considering going to a chiropractic school and they've got several choices out there, what would be the benefit that you see of them choosing to go to SCUHS versus some of the other schools out there?
Well, there's a lot of really good schools out there, and I think it just needs to be what the fit is. And we truly believe we're transforming, redefining health and healthcare education. We believe that. And
you're adding a potential another school, right? But are you talking about osteopathy, a DO program potentially?
Yeah, we're in discussions with a partner right now, and that gets into, we start with the patient outcomes. We know that improved patient outcomes come from team-based care. So if you're upstream a little bit and say, okay, let's look at interprofessional education.
Yeah.
And let's try to get these competencies where the student becomes a good team member. So they're learning from within about the other professions, so that they can respect and appreciate what the other professions can bring. And as you know, when you work in a team environment and you're tossing things out, the knowledge base and the skill set for everybody just rises, because you're just learning at constancy learning. So we're also looking at genomics, and we started a genomics institute, and it's early on. We have one director right now, but we have a certificate program, all the contents there. We're basically trying to put it into a science of learning around an online learning platform, so that we're doing things right. But we offer the Doctor of Chiropractic, the Doctor of Acupuncture and Chinese Medicine, the Master's in Physician's Assistant. We also have a Master's in Medical Science starting in the fall, and a Bachelor's in Health Science. Our Ayurvedic certificate program, we just graduated in the spring, 95 students out of that.
It's amazing.
And like you said, the Doctor of Osteopathy is, we think we need a medical support in order to really change the system. It's a medical model, and if we can, work with a program and Doctor of Osteopathy in whole person care, bring it back to the roots of
Right.
the doctor of osteopathy. I think that that's just a super team.
Yeah, I agree with you. And if you can, because there's going to be obviously some kind of naysayers out there about, you know, blending chiropractic with these other professions out there. How would you explain to them about how this really still fits with the chiropractic philosophy?
Yeah, well, we're not training chiropractors to be PAs. We're
Right.
not training chiropractors to be acupuncturists.
Exactly.
What the goal would be, and this is very difficult to do because we're dealing with so many accreditors with different rules and things like that. But my, you know, dream would be, how can we decrease the amount of education and experience and costs for people to be dually, you know, dual degrees?
Right.
You know, so if somebody wanted to be a PA and a acupuncturist, more power to them. The
Yeah.
more core courses you have, the less of a transfer in or advanced standing
Yeah.
or other courses you have to take. But you know, we're still a conservative, non-drug,
Right.
surgery profession, and you know, we do, you know, have evidence as the foundation, and there's weaknesses in that. You can
Yeah.
have dogmatic evidence-based practitioners, right?
Right. Right.
But we feel that it's the best system we have to try to level the playing field of all different professions and bring the best forward. But you know, there's no reason for us to at this point to say, oh yeah, we want to prescribe medication, because we're in a team, and we're talking about a team environment, and there's people
Right.
that have that. So
Exactly.
you know, I don't know. The haters are going to hate, and we've had a reputation that we weren't chiropractors to begin
Right.
with. So
Right.
you
Yeah.
know, this is our model, and it's integrated. But you know, you know, I think chiropractic is a wonderful profession. I'm one of them, and I want to see it, you know, really survive and grow.
Yeah, I totally agree with you there. And, you know, I have a lot of friends who have a lot of different specialties. Like, it's amazing. I had Dr. Datis Karajian on my show a couple
What a
weeks ago.
bright guy.
Oh, just scary bright. Yeah, I was telling him, I said, you know, when he and I both entered school together at 96, so we both got the Midland Honors Scholarship at entrance. I said, and that's where the similarity stopped, because that was the last time I was on the level playing field with him. But it's just amazing how, you know, we got him, who's just amazing with functional neurology and functional medicine, one of the top people in the world, you know, best-selling author. And then we got, next week I have Dr. Jason Yeager on my show, who's, you know,
yeah.
Jason, amazing guy, fantastic athlete, and you know, president. He's been the president of the Nevada Chiropractic Board. He does
swinging from the ships at
yes, Treasure Island. He was the main pirate.
That's
yes.
right.
Exactly. Treasure Island. And then you know, now he's this main chiropractic biophysics guy. He's got research articles that have been published in the British Medical Journal. Datis sits on the board of a bunch of journals. You know, we've got just a lot of amazing different doctors out there that we all came through this school. And then I have friends who are like Brad Glowacki, who's, you know, amazing subluxation-based chiropractor, amazing marketing genius out there. We all came from the same program, but we got this foundation, and we were able to go and build on it, and to go, well, this is my specialty. Or there's me, who's the laser guy, and I do, you know, international webinars, and I travel all across the U.S. Like I had, before the coronavirus thing, I had 26 different seminar dates to travel scheduled for this year, and it's just really great that we're able to come out of this program, have all these different methods of specialty, and yet all respect each other. Like, hey, that's great. That's the way you want to practice. Here's how I want to practice. Here's what I want to do. And I have some friends who don't do anything other than functional medicine. I'm like you. I love doing the sports stuff, and I combine the sports with functional medicine, functional neurology, and lasers, really focusing on how do I really enhance this athlete's performance. And I had one kid who a few years ago was the fastest kid in the whole U.S. in the 400 meters. And he actually went down to the Pan Am Games and set a world record and got a gold medal and a bronze. And it's just, I kind of live vicariously through those kids. I've seen them do that. And another one who won a Super Bowl with the Seattle Seahawks. And it's just so much fun for anybody who's thinking about getting into chiropractic, there's so many options of how you can customize this to make yourself happy and enjoy your day.
And I think you're spot on. I think, you know, some people are successful, you know, in spite of, you know, going to SCU, but, you know, I'd like to think that we provided enough foundation for them to really go out and grow. You mentioned Tatis, and I did a passage in, you know, support for one of his books, and one of the comments was, you know, it's a classic example of, you know, the student becoming the teacher, you know, and things. And I think I can say that for so many graduates that, you know, they've just, you know, they just grew so much that, you know, I'm looking up to them now. And that's a really good feeling to have as an educator. And I'm proud of so many of the graduates that come out of here.
Well, that's fantastic. You know, like I said, we're also thankful for all the help you gave us, because you were, I consider you pretty much the best teacher that I had while we were there. And we had some good ones that were on the staff too, but what was great about you is you took it and made it usable. So I remember having you as a supervising doctor, as you could take complicated things, kind of like what Tatis does with functional medicine, functional neurology. Take a complex thing and now show you, here's how you break it down. I remember one of the big things you ever recommended to me was SCUHS's book, the one with the
at the time, yeah,
and that one back in the 90s with the diagrams and everything was just like, oh my God, now instead of having all this stuff I'm trying to figure, I now have a system of going through of a flow. And that was one of the great things you taught us. It really, it's still to this day has helped me in practice every day.
Yeah, well, I'm humbled, so thank you for that. Man, would I look stupid now going back in the classroom, that's for sure. I'm like way behind. So my continuing ed has shifted, you know, obviously not clinical anymore. It's been, you know, educational leadership, change management, these types of things. And, you know, my days are spent doing much different things.
I understood. I do want to ask you one thing, that if you can just briefly, before we wrap up, get into a little bit about what are you doing with the genomics there?
Well, we basically merged a genomics institute from another institution. It's really one person, Dan Hanley, and he had a couple of research projects going out, mostly in the pharmacogenomics, right? You know, looking at the best, you know, medication, et cetera, for specific individuals. And it was working on children's ADH. So we are expanding that, you know, to look at diagnostics as well as treatment in nutrigenomics and including that. Nice. It's just brand new, and the certificate program that we're looking at is, all right, how do you become better educated on, you know, you got 23andMe, and people are using that to, you know, make diagnoses, but you got to be looking at, okay, what's the error rate on that, and, you know, keep that in mind when you're looking at it. And individuals are going to come out. How do you find a good, you know, genomics counselor, or you know, rather than the genetic side, you know, what does it mean, and what are the possibilities moving out? So finding a good lab and those types of things. But we want to, you know, and we started doing faculty development, but we want to start putting those into the core curriculum.
That's great.
So that everybody has this core understanding, and then, you know, looking at other degree programs around that, you know, in the future. So it's very early, just excited about it. And, you know, both how it can help in specific diagnoses and people who are at risk and things like that, all the way down to, you know, helping with some treatment options as well. That's
fantastic. And I think one of the great things about that, because we've been utilizing that in my office, we're doing some of the lab testing from Cyrex labs, you know, some of their antibodies. And the great thing about that is it's giving a patient knowledge of really what are they dealing with, and the fact that, hey, this is something that you're not looking at short term, you're looking at long term. So you got that. Really, what I found is for a lot of them, when they have it on paper, that they can see they've got these different immune reactions, they need to follow this stuff. It lights a fire into their butt, makes them more accountable with their dietary changes, and then also what we're going to do chiropractically and treatment wise to help them understand this is a lifestyle.
Right, right.
Yeah. Well, with that, I want to bring this to the close. Anything you want to say in closing, John? How would, let's say if students are looking to go to SCUHS, how would they get more information?
Well, just go on to our our website. It's www.scuhs.edu. That's our website. Go on there, and I keep looking down at my phone and I can't get us on the.
Facebook
I'm getting
Live?
a live stream. I don't know what I'm doing wrong. Do you have two Facebook accounts?
I have, it's still going on there. Yeah, I have just the one main one for me, but I have other ones for my office and for my doctors who are following me. I don't see any particular questions right now. I see people that are watching. If anybody has a question, let me know. I'm looking up at the top. Yeah, I don't see any particular questions here.
Okay. I guess in closing, with all this craziness right now, as we're, going through this pandemic, and I think on the other side of it could be a good thing for us. When you look at this, I think there's this crisis amplifies the awareness of good health and having a strong immune system, right?
Right.
People are seeing the unhealthy individuals are the ones at risk.
Right.
And
the key thing there is some who didn't think they had pre-existing conditions. You don't have to have a disease to have something negative.
That's right. Underlying. And we're seeing that much of healthcare can be delivered outside these hospitals and offices, and elective surgeries and procedures might be overutilized, right? I see, there's this awareness that I think would help the whole person practitioner, and hopefully we can see some inches of change away from how we're doing things now. So I'm an optimist. I think I'm a realist as well. But I think the future looks bright, and there's still a lot of work to do. But I think we're just going to keep moving in a direction that we're moving, and trying to make the changes that we can as a small institution out there.
Yeah, I agree with you. A lot of times too, you think about to make a pearl, you need that grain of sand, that irritant to cause it to make a pearl. And if you look through human history, a lot of times it's when there's a crisis that's when we have this leap in technology or a shift in the way our society is functioning. And I think that's where we have this opportunity right now to change people's awareness, because prior to this, a lot of people were just mindlessly going through on their social media and, eating whatever, following the Kardashians, and, looking, or these Instagram influencers or whatever. And now it's shifted, and people are taking a focus on, well, let me follow someone who's actually a health influencer, someone who really knows what they're talking about, not somebody who's done some little 24-hour certificate or joined a multi-level marketing kind of thing and is now as an expert and a supposed expert in something. They're looking for real people with expertise and with answers and how to plan things out for the future.
You're absolutely right. So
well, thank you for being on the show today. I appreciate everything you've done and everything you're doing for the students going forward.
Oh, you're welcome. My pleasure, and it's been fun. It's really, really good to connect up with you again.
Fantastic. Let me stop this recording.